أعوذ بالله من الشيطان الرجيم. أومن كان ميتا فأحييناه وجعلنا له نورا يمشي به في الناس كمن مثله في الظلمات ليس بخارج منها كذلك زين للكافرين ما كانوا يعملون وكذلك جعلنا في كل قرية أكابر مجرميها ليمكروا فيها وما يمكرون إلا بأنفسهم وما يشعرون وإذا جاءتهم آية قالوا لن نؤمن حتى نؤتى مثل ما أوتي رسل الله أعلم حيث يجعل رسالاته سيصيب الذين أجرموا صغار عند الله وعذاب شديد بما كانوا يمكرون. صدق الله العظيم.
MashaAllah. Hi, Assalamu alaikum. I am so excited to stand in front of all of you today. My name is Farhiya Budul. I am the founder of NIYYAH Recovery Initiative, and I am also a woman in long-term recovery, alhamdulillah. Today is an important day for all of us. For our East African community listening session, I want to thank the Office of Addiction and Recovery for an amazing collaboration with NIYYAH Recovery Initiative. The opioid and substance use epidemic is affecting all Minnesotans, and particularly Minnesota's East African community. You all know that we have all had one person in our households and our family members who have overdosed. Today gives us an opportunity to be heard from community to our state leaders. I would like to thank our great partners, Cedar Riverside Community Council, Twin Cities Health Services, Cedar Riverside Youth Council, and everybody who pitched in to make this event successful today. Maanta aad iyo aad baan ugu faraxsanahay inaad maanta nagala soo qaygashaan xafladan qiimada badan oo laga hadlayo muqaadaraadka communitygeena siduu u dhameeyay. Maanta waxaa haysanaa opportunity oo nalagu dhagaysto dadka leaderska ah oo office ka shaqeeyaan stateka. Waxaa weeyaan dad ma aragtay aad iyo aad awood u leh waana kuwana hadeertaan. Marka insha Allah hal ismaqlo cunto way taalaa sharaab uu yaalaa. Marka insha Allah waxaan rajaynayaa maanta inaan ma aragtay si fiican isku dhagaysano. Waad mahadsantihiin. And right now I'd like to turn it over to Jeremy Drucker from the Office of Addiction and Recovery.
Thanks, Farhiya, and thank you all for coming. I hope it's okay if I sit. We're just going to do a quick round of intros here. But I just wanted to thank you all for coming, to thank Farhiya for her partnership. Let's give Farhiya a round of applause. Farhiya also sits on the Governor's Advisory Council on Opioid Substance Use and Addiction, and she's just a fabulous champion for all people in recovery, but in particular her community. I want to thank you all for coming. This is really important for my office to be able to hear directly from you. As Farhiya said, my name is Jeremy Drucker. I'm the Director of Addiction and Recovery for the state of Minnesota. This is a new position that was created last year by the governor and legislature to really help work across state government, to help align our efforts across the departments of human services, health, public safety, corrections, education, higher education, and the Interagency Council on Homelessness. And so our goal is really to be more effective and more efficient and really move Minnesota towards measurable outcomes in addressing substance use disorder. And I know that many here have been affected by it. Me personally has been affected by it. I'm a person in long-term recovery. But it's really important that we hear from you and that we take your voice back as we do our work and work with the state agencies. One thing I want to say, we have a great panel tonight. These are some of the top leaders in the state at different levels working on this issue. And we all have different roles in state government or county government. Some are in the Attorney General's office, some are in the state legislature, some are in different political parties, but we're all on the same team when it comes to addressing substance use disorder. And so we all want to hear at the same time what you're saying so that we can be more coordinated and we can have that same understanding as we're going back to do our work. And so thank you again for being here. Really looking forward to the conversation. And I would just finally add that this is, in my mind, the start of a conversation. It's not the end of a conversation. So this is the first time we're talking, but it's not going to be the last. And so really looking forward to engaging in this work with you all. And with that, I'm going to turn it over to Julie Bach from Hennepin County.
Julie, use this one.
This one. Hello. Farhia, do we need to pause for translation on any of our talking points? Okay. Okay, thank you.
Yeah.
Hi friends, hi colleagues. My name is Julie Bauk. I work at Hennepin County. I'm Hennepin County's opioid response coordinator. And Jeremy, thank you for introducing me and gathering this together. He told me that I have 3 minutes. So I'm going to go really fast on what Hennepin County is doing for the opioid crisis. So we have a framework and we have a leadership team to implement the framework. We are guided by 3 pillars: prevention, response, and treatment. We are going to get opioid settlement funds from national settlements. Hennepin County is going to get approximately $42 million over 18 years. That number will probably go up over time as more settlements come in, but we are not sure of that exact number. So I'm going to go through really fast on our 3 pillars of what we're going to spend settlement dollars on. So for prevention, we currently have 17 community contracts to do community prevention and response work in the Somali East African, American Indian, African American, and unsheltered homeless population. 6 of these 17 contracts are Somali East African specific. And if you want to know what those 6 are, I am happy to email that out and get it to this group after the end of this session. We will expand the dollar amount and the number of those community contracts with settlement dollars. We currently have data that drives our intervention, and we will expand and make our data more robust and public-facing to drive intervention. We will launch a culturally specific fentanyl education risk campaign driven by community voices. We will expand child protection care for people who are pregnant and have an opioid use disorder. Okay, next pillar, response. As a part of our response pillar, we invest heavily in harm reduction tactics. With settlement dollars, we will continue to do this through the expansion of RFPs to community contracts, and we will continue to do this through the expansion of Hennepin County services. Harm reduction tactics include infectious disease testing, overdose spike alerts, naloxone distribution and education, syringe exchange, and fentanyl test strips, just to name a few. All right, 3rd pillar, treatment. Treatment. As part of the treatment and recovery pillar, we support and invest heavily in clinical treatment best practices, namely the easy, affordable, reliable, and culturally specific access to Suboxone. Suboxone is the medication that treats opioid use disorder. With settlement dollars, we will continue to do this clinical treatment through the expansion through RFPs to community contracts, and we will continue to do this with the expansion of Hennepin County clinical and correctional services. We will also expand long-term recovery services, including community contracts, 1800 Chicago, in-home family recovery, youth treatment and recovery, and Project Child. So what I just mentioned really fast, 3 pillars, is not an all-expansive list. But it's just to show you how we're strategizing our funds, that we are using the 3 pillars, and it gives you an outline of what we're thinking. If there's anything that's missing or that you didn't hear, you want to talk about more, please reach out to Hennepin County. I'm always here to talk to any of you. And I'm so sorry I can't give you an introduction, but I'm gonna pass the mic on to my colleague.
Thanks, Julie. Good afternoon. My name is Maria Sarabia, and I serve at the Minnesota Department of Health. I serve as the Assistant Commissioner of the Health Improvement Bureau. What I'd like to do today is just take a few moments to introduce myself. I'm newly appointed in this position. I've been in the role for just a few weeks, and I'm learning of all the amazing work that's happening at MDH, and I'm also learning of opportunities for us to improve and strengthen our work so that we can connect with communities who are most impacted by this issue. Some things I want to share with you is that we're looking at work through MDH through the lens of services provided in terms of caring for people who are suffering with substance use, services in terms of being culturally specific, having a very focused approach at the community level and funding local public health, working in partnership with counties, faith-based organizations, not-for-profit organizations, as well as employers, communities, and clinics, so that we can have a multi-pronged approach to dealing with folks who are suffering and recovering from substance use. The other thing I'll share is that we are working to increase our understanding of the various, whether they're familial, family, community, individual, or systemic and structural challenges that are causing barriers for us to recover from this situation. I will say that MDH has a lot of data, and so we want to be more forthcoming and share data and how we can use data to better understand preventative efforts that are on the ground at the community level. And moreover, we too have some funding that's coming out, and we want to use a multidisciplinary approach, an approach in which we're able to work with different levels of community, different types of organizations. One thing about me is I'll say I came from the Ramsey County system prior to being in this position, and I've worked in a lot of different local public health or social service agencies. And I know that the solutions to our challenges are often in community settings. And so presenting to be a little bit more humble and more power sharing and using our data and using our resources for community-led efforts is an approach that's important to me. And I think that's a really great leadership role that Jeremy's put together and this panel is working towards collectively. If I wanted to share a few more data points, MDH is filled with very brilliant statisticians, scientists, people. My role oftentimes is to translate that into plain language and talk about matters with real people. So what we do know is that in 2021, Minnesota had 1,286 drug overdose deaths. What we also know is that folks who come from African American, who identify as Black or Eastern African, that's 3 times more likely folks to die from drug overdose than white Minnesotans. The data is more stark with American Indians in terms of there's data showing that we have 9 times more likely to die of drug overdose than white Minnesotans. And this is also compounded with folks who are struggling with unsheltered situations or homelessness. And again, I come to you as probably a newbie on the panel, but saying that this is an opportunity for us to work in collective, use this data not just to look at the problem but with some solutions and community-led solutions and working in partnership with folks. So I'm really thankful for what's happening at the county levels, and I know it's hard work. I'm going to pass this off to Mr. Keith Allison.
Thank you. Let's hear it for Ms. Sarabi. Bismillah, assalamu alaikum wa rahmatullahi wa barakatuhu. It's so good to be with you all. The first thing I want to say to you is that Allah subhanahu wa ta'ala forgives. Allah forgives sins to people who ask for forgiveness. And the reason I say this is because I know, and so does everybody in this room who's Muslim, that drug use and alcohol is haram. And so, many who are suffering from substance use disorder are burdened by shame and embarrassment, and they don't want to show up in the mosque until they get themselves right. But in order to get yourself right, you need to come into the mosque, and you also need to go to treatment. Now, this is a issue that we don't talk about enough. So everybody who's here to talk about this, I just want to say, alhamdulillah for you, because you're demonstrating the courage to take control of this demon that is holding you back and making your life worse, and you are doing something about it. So I just want to say it is an act of iman, and it is an act of faith for you to take an affirmative step to discuss this very important issue. Does anybody hear me out here? And you don't have to tell me that substance abuse disorder is a problem in our Muslim community, because I already know it is. And you already know it is. The question is, what are we going to do about it? And what I want to say is we got to keep meeting like this, keep working like this. We got to not shame and blame each other. We got to invite each other in, not call each other out. So let me just say, at the Attorney General's office, I'm not a health person. All these people are health people. I'm not a health person. Oh, we got some legislators, but I'm not a health person. Either the health legislators. I'm a lawyer, and my office has recognized that the companies that started this opioid mess did it with deception, lies, and deceit. It's kind of like opioids themselves. In the beginning, it's like, oh, this is going to make you feel better. Right up until it don't. Right up until you feel like it has a grip on you that you cannot break free from. But I'm telling you, we have sued these people because of their deception. We have brought them to court, and we have so far, and I got to bring a piece of paper to figure out all of the money we've fought back for. So far, we're up to about $560 million, and we've sued companies of Purdue, Insys, Johnson & Johnson, Mallinckrodt, Endo. I don't need to read them all. You know why? You know them all. Yeah. We've not just sued the people who made this stuff. We've sued the people who distributed this stuff. McKesson, Cardinal Health. We've sued the pharmacies who pushed it, CVS, Walgreens, Walmart, and consultants like McKinsey. These people marketed this stuff saying it was non-addictive pain, but it was highly addictive, and they knew it, and they lied. So that's why we sued them. Now the question is, now there will be payments coming over the next 10 years. It's not all coming at once. And the legislature, and I really want to say thank you to the legislature, because normally when my office wins money in a lawsuit, it goes into the general fund. But what our legislators have done is said, no, you know what? This money is going to go into a special fund designed to help people, right? And this is good. This is very important. And so, but the issue for us today is to make sure that the money gets where it is needed. I'm going to tell you, I said it before and I'll say it again. The money should go where it's needed. I don't need to keep the money at the AG's office, and the legislature said we don't need to keep the money here. It needs to go to the counties, and it needs to go to health, and it needs to go to people to break this chain. So I just want to tell you, we got some other cases that are outstanding. Purdue Pharma, these people are, in my opinion, misusing the bankruptcy system. They apply for bankruptcy so they don't have to be accountable, but we're chasing them into bankruptcy, and we will chase them wherever they run. And I want you to know that. And so And so I just want to say that when we find these people, we are going to hold them accountable. We're not done. And I just want to sit here and listen to you. But the main thing I want to say to you is, it is very important that when you find a loved one or a friend who, because most people today are Muslim, right? And if you feel that a friend is like, you know that they're addicted to opioids, giving them a harsh lecture is not necessarily going to help them get free. Telling them, brother, sister, come with me. We're going to deal with this. We're going to work with this together. That's how we're going to get people free. And prayer helps. Prayer helps. But prayer helps. Showing up for mosque prayer helps. But going to treatment helps too. It's not one or the other, it's both. Is it both? Well, that's all I want to say then. Thank you very much. So let me say, this is my friend Jody Harpstead. There's a lot of people who are smart about health care. Of all the people I know, she's the smartest. All respect to everybody. And she's really a hard worker, and I'm so glad she's here to share with you guys today.
Thank you so much.
Sorry, Jody's going to go in just a second, but we heard that there needs to be a translation done for some of the things that came, that were said first. So we'll do that, and then we'll go back to Commissioner Harpstead. So, Mr. Attorney General, if you want to redo that introduction for her, I'm sure she wouldn't mind. So.
بسم الله الرحمن الرحيم wuxuu ka hadlayay attorney generalku in yani waxyaalo badan oo dhibaatooyin oo ay ka mid yihiin opioidkii iyo maxaan ku yiraahdaa hay-ado badan oo iibiyey dad badan oo community-ga ka mid ah iyo macnaha state-koodil dhibaatooyinkii soo gaaray iyo dhibaatooyinkii dadka ku cost garayso iyo organizationno badan oo ka faa'iiday been ka sheegay riixay sidii ay community-ga u waxyeelayn lahayd in maxaan ku yiraahdaa laga shaqeynayo sidii loo dacweyn lahaa oo dhibaatadooda wax looga qaban lahaa ayay aasaaska ku saabsanayd haddii intii kaleetana waxay ahayd in dadka dhibaatooyinkaas haystaan aynu ula dhaqanno si canaanta iyo ku qaylinta inayna waxba ka dhimayn ayna waxba tarayn waxa wax taraya ay yihiin in qofka la soo dhaweeyo la dareensiiyo in garab la siinayo sidii dhibaatada loogala shaqayn lahaa siduu ka bixi lahaa in loola dhaqmo loo duceeyo daawooyin baa jira ee la daaweeyo oo maxaan ku yiraahdaa lagu geesnimo geliyo sidii daawooyinkii uu uga xoroobi lahaa dhibaatooyinkaas maxaan ku yiraahdaa uga qayb qaada u mari lahaa dariiqeedii intaa iyo ma wada xusuusan kara waxay ahayd qorsho inaan consecutive sameeyo wixii aan gafay waxaan rajaynayaa qof walba qof luqadda yaqaana dhinac fadhiya in la isgaarsiiyo laakiin intaas ayaan ka xasuusan karaa wixii aan gafay aad baan uga hadlaa
Thank you. And I think Representative Noor is going to do a recap too later. So, Commissioner, it's your mic.
Thank you very much. Good evening. I'm Jody Harpstead, the Commissioner of the Department of Human Services. Before I came into my role in state government, I spent 15 years at Lutheran Social Service, and one of our roles there was to resettle many families from Somalia, East Africa. And I have learned to develop a deep respect for your spiritual values and a deep respect for your resilience, your resourcefulness, and your entrepreneurism. I'm so proud today to see so many East African-led nonprofit providers who are serving their community with culturally specific services. And it's, yes, thank you. So thank you for doing that, and I'm so pleased that you've stood up to put yourselves to that work. I know that in that role, as you work to create and run nonprofits serving your community, you often run into our licensing division as much as any other part of the Department of Human Services. You may recall when I first started as commissioner, I wrote in on headlines of overpayments and problems, And so we've been working for the last several years to get every single thing in order. And we have a history of being good at getting every single thing in order. I want you to know that over the next several years, our goal is to be known more for caring, responsive, and flexible, and then for keeping everything in order. And we're working hard to change that culture. Yet it's a delicate balance, right? If we are caring and flexible and responsive and we make a mistake, we'll be all over the front page of the paper again in the audits about not keeping everything in order. If we keep every single thing in order, you won't get the flexibility you need, we won't get money out fast enough, and we're always trying to find that delicate balance. So I appreciate your partnership with us in trying to find that balance. I was just talking to Kalani Moti this morning, our Inspector General, and she and I were discussing the possibility of a liaison in her department to the East African community. Someone who could listen to you, bring in issues, help you troubleshoot problems, help us understand your unique needs, etc. And we're going to continue that conversation. And so thank you very much for your very good work. We're so proud of how far along your nonprofit providers have come, and we hope to work even better with you as we go forward. Thank you so much.
And good evening. I'm going to stand as well. Mahatsanid. My name is David Baker. I am from the area of Wilmer, Minnesota, 100 miles west of here, and we have a lot of East African members in my own community that I have gotten to know and appreciate and understand their needs and how we can help them in this world of substance use disorder and addiction, and it's not easy. For some of you that don't know, again, I'm one of the legislators with my friends here. We did a lot of good things this year to help residents around the state of Minnesota, and these gentlemen will help understand and explain some of that in a little bit. I'm here because my son died of an overdose, and I don't want that to happen to you. My son Dan died 12 years ago because I didn't know what addiction was. I didn't know what a pill did to him when he got injured in his back playing softball. So I learned a hard lesson in the world of losing a child. And he was 25 years old. I miss him so much every day. And your community is being harmed greater than almost any other community out there. I have worked with other legislators in the Minneapolis area, with our friends from Hennepin County. We know you need a lot of help here. But as Attorney General Ellison said, do not be shamed by this disease. This is a disease that doesn't want you to talk about it. It doesn't want you to share your pain with others. And I will tell you, I didn't know better either. So we are here today to listen to you. We're here to understand better the needs, how you need to heal, what do you need from us as policymakers, and then we need to get out of the way. We need to make sure you know what you need, but do not be ashamed by this disease. And I'm here in Dan's honor to come here tonight to tell you our work is never over. We are traveling all over the state of Minnesota to share this message so that you all know we're here to help you because we are driven by passion. I don't care how much money we're getting, it doesn't matter. You need to understand you can't be silent about this. We are here to help. We have lots of places to find you help, healing, shelter, treatment. Everybody finds treatment and recovery a little different, and it's okay to be different. But we're here to help, not to be shamed. I'm honored to be here tonight. I'm grateful to finally be here in downtown at Riverside. I'm so honored to be here, Mahatsanid.
Nabud. I'm Senator John Hoffman from Brooklyn Park, Champlin, Coon Rapids, Dayton, and the wonderful city of Rogers. Nabud means hello, right? Now, akam is the other word that I say hello because there are Oromo here. So thank you for letting me be part of this conversation. And Attorney General, your comment about shame is exactly the root of why we're doing what we're doing, right? Because that labeling effect that occurs. And thank you for pointing that out. And the leadership of the ORAC committee that you do for years, Representative Baker, that lived experience that you have as a parent of a child that actually had this coming up. And I just wanted to say it has been a joy this year to work with you, Commissioner Harpstead, to be part of this. And I just wanted to say thank you for letting me be. I am the chair of the Minnesota Senate Human Services Committee. I work in conjunction with the Minnesota House Chair, which is this gentleman to the right of me named Mahmoud Noor. So Jeremy Drucker, thank you for letting me be here. Ladies and gentlemen, Mahmoud Noor.
Assalamu alaikum. وحقوا والد جفا السلام عليكم. حقيقي waxaan jeclaan lahaa dadka walaalahay khaasatan inay dareemaan dhibka weyn uu nagu hayo daroogada dhalinyarada isticmaalaan khaasatan inkastoo dadka waayeeladana isticmaalaan dhibka weyn ee nagu leedahay iyo saameynta weyn ee nagu leedahay iyo ka hortagga loo baahan yahay xaqiiqdii waxaa loo baahan yahay inaan gacmahaas wada qabsanno inaan badbaadinno jiilka soo socdo cudur oo la arki karin oo daawo toos lahayn baa saameyn weyn ku leedahay dhallinyaradeenna Soomaaliyeed xaqiiqdii wax kastaan soo qabanno alxamdulillah waa ku soo guulaysan laakiin guusha oo xagga shaqadan ku jirna ma ahan guul haddii aysan dadkeena ay dareemi karin si loogu badbaadi lahaa dhibkan hadda laga hadlayo xeer ilaaliyaheena guud si toosa uu nala hadlay dhaqaalaanna ma hayso waxaana haysataa aqoon darro waxaana haysataa in dadkeena laga waayay inay iskaashadaan ee si toos ah loogu hortago dhibkan waxay ag fadhiyaa qof oo maaragtay qiimo weyn ugu fadhiyo inkastoo isku xisbi aan ahayn waxaa waayey waa qof oo hogaamiye ah waxaa ka dhintay wiilkiisa wuxuu u dhintay daroogada saameyn weyn bay ku yeelatay 5 sano dadaalkeeda baan kula jiray miiskan wada fadhinay 5 sano inaan xakamayno dadka daroogada sameeyo si loo heli lahaa dakhli ku filan in laga hortago dhibkana soo fodhayo in xaqiiqdii dareenku dareensan wuxuu leeyahay caruurtiina sida ugu badbaadi lahaayeen dhalinyaradiina sida ugu badbaadi lahaayeen waa mid aniga toos ii taabanayso in qof kale oo maaragtay shakhsi kasta oo gobolka Minnesota joogo inuu ku naf waayo wax laga daaweyn karo sababta cudur weeyay ma ahan wax xumaan ah dadkana waxay u baahan tahay dad aqoonyaan ah waxay u baahan tahay dad fahamsan dad soo darsay dad oo khibrad u leh dad oo bulshadooda u istaago maanta haddaynu intaasoo dhaqaalo taal waxba inima tarayso sababta dhaqaalo waxba ma tarto wax dadka tara waa dadkooda qofkii garab fadhiyana waxaa waaye saaxiibkii hogaamiyaha guddiga sanadka oo human service hawshan soo qabanay lama soo koobi karo xaqiiqdii maanta danda waxaan ka hadlaynaa wax qabadkii aan soo qabanay oo ka hortagan ilaa khaasatan iskoolada waxaa u diyaarinay dadka inay fahmaan dhalinyarada hawshan waxay ku bilaabataa caruurta intay middle school ku jiraan ma bahan mid oo qofkii markuu qaangaaro ay ku bilaabanayso haddii gurigii hooyadii dareemaynin haddii uu aabbihii dareemaynin haddii walaalkii maaragtay walaalkiis caawinaynin sidee baan ku badbaadi karnaa gurigay ka bilaabataa waxaa ku xigaa goobaha masaajidka goobaha bulshada waxaana ku sii xigaa bulsho weynta oo dhan oo mas-uuliyadna saaran mas-uuliyaddaas oo dhan anaga dhan baa gabnay qof qaatay oranay maanta aniga badbaadina dhalinyarada waxba kama jiraan runta inii sheegay sababta hawsha waa badanta waana ballaaranta haddii ballaarantana googasheedana waa la sii badiyaa caruur baan dhalay waa dareemi karaa hooyo ka mid ah meesha nala joogta cunugeeda wuu xiran yahay wuxuu u xiran yahay xanuun daraaddeed maskaxiyan xanuun baa gaaray daawooyinkaana wuu isticmaalaa maxkamad baa la geeyaa bannaankaa loo soo saaraa meel recoverya la geeyaa wuuna ka soo baxaa markuu ka soo baxdana xabsiga ku sii jira dhib intaas la eg oo hooyo waa dareemi kartaa cunugeeda u danqanaysaa ma aha inuu xabsi ku jiro maanta ma aha cunugaas oo u baahan daryeel inuu xabsi maanta ku jiro waxaana laga waayay qof oo shakhsi ka fikiraynin tiisa inuu ka fikiro dadkiisa wax u tari lahaa yes meel goobo badan baan furanay yes qof walba dan gaar buu wataa dan gaar qof wato waxba kuma tarin qofka oo dareemi kara waa qofka ku gacan qabanaya hooyadaas intuu gacanta qabto meesha geeyay maxkamadooda cunugan si xaq daraa lagu haystaa maanta waa wada tashi laakiin talada waxay u baahan tahay qof fahmi karo taasaytan waa sii wadayna waa wada tashanayna walaalayaalow aan wada tashanno midda kalena aan isku tashanno ilaahayna taladaan saaran wax yaran u soo koobaya just expressed my deepest sadness in what is happening in overall. Then I also talked about a mother who's sitting among here today. Her son has got mental health issues. He has got substance use disorder. He's now in jail. The court systems, he's been there a couple of times, and every time he gets out, goes to recovery, he goes back into the system. So what I told them that we failed that child because he needs more than just being in a jail when he needs a recovery that will meet the needs that he has. That's right. And we talked about the challenges that we foresee. No matter how much we did through legislative process, if it's not going to save lives, we have done nothing. Doesn't matter. We can put all those good bills, we can talk about all good things. And I just want also to thank our Attorney General Keith Ellison for the resource that he just talked about. But what did we do through legislative process with the chair of ORAC and us trying to navigate that process? We said 75% should go to the local government. Your city, your county, and your local government have the resources to start looking for ways to address this. I'm not excusing the state. We have a lot of resources to do the same thing. But we have to start at the local level. There has to be a seriousness. Trying to solve a major problem with a 50,000 grant is not solving the problem. And part of our continued process, while I sit down, my next commitment is to make sure that we have a waiver that addresses the social determinants of health. Because we need to have a transitional housing, we need to have food, we need to have employment, we need to have things that can be done through the Medicaid process so that we can solve some of this cyclic process whereby we need transition process to help individuals recover and re-enter their communities. Even for those who are coming out of incarceration, they need a good place because we need to do better. And when we all do better, we do better. So thank you so much.
السلام عليكم ورحمة الله وبركاته مقعي علي أبشر عيسى وحان لشقيا حافظك حلبانة إلهان عمر آد بشرفنا وقتها هنا نكرسو قيب قلنا كلن كان وأمهد علنا يا فرحيو يو نيو ريكوفري ريكوفري it's not only recovery دبعتها community أنا هايستا آدم وغفر أحسنها دور سنة كور إنها فرحية برتي نيو ريكوفري إنها وحوين كبد الشيء impactiga ay ku sameynayso drugska iyo dhibaatooyinka kale ee homelessnesska iyo mental healthiga ay dhallinyaradeenna ku hayaan farxiyo aad baan ugu mahadcelinayaa waan aaminsanaa maalinka ugu horreeyaan la kulmay dadaalkeedu inuu miro dhal noqonayo waayo waa qof maaragtay waayo arag ah wax badan ka og waxaan kaloo u mahadcelinayaa madaxda legislatorska iyo Keith Ellison oo asagana gacan weyn ka geysanaya iyo Minnesota Recovery oo runtii aad u soo caawiyo farxiyaan ogahay annaga xafiiskeena si gaar ah ula shaqeynaa NIYYAH Recovery waana wadaynaa marka sida maxamuud uu sheegay resource in la raadiyo kaliya ma ahan wax ka qabadku waa in communitygu gacnaha intay isqabsadaan ilmaha yararka oo jidka taagan markaan sii marayno inaan salaano la sheekaysano ogaano waxa ay qabaan ayadu waxa ay qabatan intaas waaye mid kale ayada inaan gacan siino waaye organizationkeeda saan la dhisi lahayn I want to thank you all for giving me this opportunity thank you.
Thank you all so much. You all are amazing. Thank you for taking the time to come and be with community. It is a much, much needed conversation. I want to go back a little bit and thank our partners. I kind of forgot to mention a few. Thank you, Brian Coyle, Amano, and Awal, Pillsbury United, Twin Cities Health Services, Cedar Riverside Community Council, Cedar Riverside Youth Leadership, Generation Hope, Advocates for Thriving Communities. I want to thank Oasis for the amazing food, Oasis Mediterranean, Amina Dible. Thank you so much for serving food to our community. MashaAllah, and all the Hoyos. I want to all the volunteers for NIYYAH. Thank you so much for supporting me today. And we're going to hear from some of our stories of hope and recovery because recovery is happening. As I stated, my name is Farhiya Budul. I am a woman in long-term recovery and the founder of NIYYAH Recovery Initiative. I've struggled with the disease of addiction. And alhamdulillah, and thank you, Attorney Keith Ellison, because Allah is Ghafurur Rahim. Allah forgives all sins. And we want to be able to understand how stigma and shame as one of the barriers to our community members, that is one huge barrier, is stigma and shame, lack of education. We want to be able to work better with ORAC, our state agencies, DHS. We want to be able to serve our communities better with the right resources because we're not able to work better together without adequate resources. So today you're going to hear from community and also people in recovery. I want to invite a few of our volunteers today, Hafsa, Mahmoud. I also want to bring up Asma. Come on down, ladies. Yes, mashallah. And Abdurrahman Ali from Generation Hope. Abdurrahman from Generation Hope and Ali. So I'm going to turn it over to them to help for them to share their own recovery stories. So these are the voices that we're helping to empower these women right here.
Hello, my name is Hafsa Mahmoud. I'm not telling my story today, but I'm a woman in long-term recovery, and I'm so grateful to be in recovery today. Yeah. Thank you. Attorney General Keith Ellison and Representative Mohammed Noor, our communities need help. We need help, and I'm so grateful for people like Farhiya and Ryan Vasquez and other people in long-term recovery. And recovery is happening in our community today. Thank you.
Assalamu alaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. My name is Asma. I'm part of CRCC. I'm part of the ambassadors team. I wasn't an in-treatment patient, but I was an out-treatment patient, and part of the reason why is because of the grants that the government allowed and programs that the government allowed to have in this community where young adults can have a second opportunity within this community. But part of recovery has a lot to do with the environment we're in. And what we're asking and what we're demanding more of this community is, especially from you, Keith Ellison, I know you helped a lot with the homeless encampment, but we need jobs here for the adults and the youths. We need an in and out facility. We need more programs like ambassador programs for people to come. We need walk-in centers. Even with the fences of the homeland encounter, you guys put fences on there, which we don't feel good about because it's just going to tell them to immigrate by Seven Corners or by the train station. That's not what we need. We need you guys to get these people a walk-in center. There's a whole parking lot that has space where you guys can build for facilities for people to come. So we need more jobs here. We need more programs for our kids and our children. We need ways. We need more people of colors to come here and help. You know, but with that being said, we are grateful to have people like Ryan, Farhiya, Zach here to be the strength to keep the glue, to keep it going. Even though we made progress, we still need more help. And we've been advocating and saying that, but our voices is not heard until it's too late. And that's not fair.
Hey, my name is Abdurrahman Warsame. I'm a person in long-term recovery. I'm also the co-founder of Generation Hope and the executive director. I wanna really just give Farhiya her flowers here. I don't know how much you guys know. Farhiya is the first LADC in our community. She was talking about this problem more than 15 years ago. And she's here today still speaking about this problem. So we really need to give her flowers. So I'm a person in long-term recovery. My story started here. I was born and raised here in Cedar Riverside. My first time even telling my story was actually in this same room here 4 years ago. And some of the people that were with us are here today, and there was even some people in the crowd that are not here with us still. Right, this is an issue that has been damaging our community for so long, and one of the biggest issues in our community outside of stigma or alongside it is accessibility. People don't know where to go. When I got sober, I had no clue what Suboxone was. I had no clue what methadone was. I had no clue what even Narcan was, although I had overdosed so many different times. I think that one of the biggest issues is that we don't know where our resources are. And it's so important as to why is there such a lack of equity? Why is there such a lack of resources within our community? There are so many other individuals outside of our community that are getting access to resources, access to funding that our communities are not getting. And so for myself, I mean, there was nothing like this. You know, and it's so amazing that things are like this are happening, where there are listening sessions and you guys are finally listening to us. But you need to empower individuals that are doing this work. That's so important. There needs to be more access to, you know, even people outside of this community need to be more culturally competent. What does it mean to be Somali? Why is it such a stigma within our community? It's such a unique situation, and there needs to be more data. There's so many individuals that are dying in our community. Nobody knows about it. Right, and so our voices need to be heard, and I want to thank you guys again, you know, for just being here, and I want to thank Farhiya for putting this together. But our stories don't end here, and we need you guys to help us and make that happen.
Assalamu alaikum wa rahmatullahi wa barakatuh. Can we give a round of applause to these champions? That's the fact that we're talking about our problems a normal thing, and to have courageous leaders to have our backs out loud and in person is something that goes far beyond words. And I want to thank you guys so much. And that gap that Farhiya Budul has bridged. I met this woman 3 years ago here at this little room right here, having Milita Islami meetings, and what she's introduced me to in the recovery world, in the recovery atmosphere, the culture, I could write a book about it. But my name is Ali Samator. I am someone who practices long-term recovery. I am somebody who's been drastically impacted by the opioid crisis. As somebody who's overdosed twice in the city of Minneapolis, it's not shame, it's not guilt, it's not stigma, it's not knowing, and a culture we grew up in, a culture as in nobody cares about your problems. You know, you're a man, you brush your shoulders, you get up and you go. But we need to care about our problems because we have generations that look up to us. We have kids in the back that rely on TikTok and YouTube videos and VH1 as role models. When there are role models in this room, y'all, like mashallah, barakallah, they're organization leaders in here, legislators, our brother Keith Ellison, who's frontline Attorney General, alhamdulillah, Farhia Budul, who's building these, gapping these bridges. I just want to take a moment to say that we need role models in our community. We need to have this, we need to stop doing this thing where we look down on each other and really look and be proud of each other. If you see your brother struggling, you pick him up. You don't make fun of him. You don't laugh at him. You don't clown him. You pick each other up. Because at the end of the day, we're one ummah. Our great country of Somalia has one deen and one culture, correct? We come here and that doesn't work no more. I don't understand. So we need to stand on what we stand on, right? And we need to really take heed to these great leaders that are sitting up here and work with them because they cannot do it on their own. I can only imagine Mr. Drucker's email Monday morning. I could only imagine. So let's work together. Something I do in the community is be a role model, right? I might not have it all figured out. I might not be perfect, but I'm gonna give what wasn't given to me. I'm gonna give what I was neglected of as a child, and that's somebody not only doing it, making it happen. Hey, I made the B's list for MCTC summertime. I'm very proud of that, right? I'm very proud of that, right? We don't make the B's list. So alhamdulillah, Farhia, you did an awesome job. Thank you so much for this abaya. And this is just the start. This is only the beginning. I love you. Assalamu alaikum.
MashaAllah, can we please give a round of applause and make some du'as for these amazing recovery champions? Yes. You know, I was looking around in the crowd and I saw Damone. Damone is here from the city of Minneapolis. He's the city commissioner. Please come up here. Come up here. Damone is here. So I wanted to just take a moment for my community to also get to know our new health commissioner from Boston. Yes,
Wassalamu alaikum. Good evening, everyone. Thank you for having me here. Thank you. Very excited to be here. We are working diligently on the opioid crisis in conjunction with our homeless work here in the city as well. We're working on plans to coordinate with the state, with the county, with other city departments to bring resources to the community. As many of you may have already heard, we have some settlement dollars that we're planning for right now that will be coming very soon. I am from Massachusetts. I've been here for about 5 months, but the experiences are similar. I have family members, as you do, and friends who have died and who have been impacted by the opioid crisis. We are here to help. We are bringing a different mindset to the way that we deliver public service. We want to have an accompaniment model to public service, where we are alongside the community providing services and support. The health department, we understand, okay, thank you. We understand that we don't necessarily create health, but we help impact health by partnering with communities like yourself. And so for here, I want to thank you for giving me the opportunity to say a few words. Thank you for your esteemed guests here, and I look forward to working with everybody in the future.
Thank you so much. So this is the time y'all be waiting for. Alhamdulillah, we came down to our partner, all of y'all as community, to be heard. So if you're interested in speaking, we're going to turn it over the mic. And first, our president of the Cedar Riverside Youth Leadership, Mahad. Woo!
Assalamu alaikum, everyone. My name is Mahad, as Farhir already told you guys. I'm the president of the Cedar Riverside Youth Council. I'm here to talk to the elected officials here today and ask them that we need more funding for our kids here that are struggling, that they need to be respected and to get understanding. They've been trying to talk to you guys for a while. So if you guys can please support them and more funding, and that's what we're here for. So if you guys can please do that, that would be amazing. Thank you.
Thank you. Now we're going to have Habriyer right here. Her name is Nasra. Come. She's a community member, a longtime Cedar Riverside resident, and she has also been impacted by the opioid epidemic.
Okay. Hi guys. Hi everybody. How the guys? My name is Nasra Hassan. I'm mother for Cedar Riverside. So today, amazing for mothers. We always cry in the street. We see our kids. They do. We can't have single mother. That's what we need. That's what we need for special mother. Please, guest. Marka Soomaalideenna dhageysta marka maanta alxamdulillaah rabbil caalamiin gabadhan farxiya ah horta dhulkay naga soo qaaday runtii waxyaalo badan ani waad iga aragtaan YouTube-yadan oo ka ooynaya ama wax kasta sameynaya laakiin wax kasta waqti iyo bay leeyihiin alxamdulillaah rabbil caalamiin waxaan ilaahay qadarina nooma soconayo gabadhan yarta gacan inaan ku siino way dadaalaysaa qofka hadduu dadaalayo in gacan lagu sii aad bay u fiican tahay isbishaal hooyooyinka Minnesota jooga oo maadarka ilmaha dhalay cunugaaga 16 17 18 hadduu ku jiro awood kuma lihid waa inaad awoodda la raadsataa meeshii aad kaga caawin lahayd okay cunugayga wuxuu ahaa markuu yaraa wuxuu ku bilaabay 16 jir 16 jir maxaan ka qaban karaa waa sii baxaya ma qaban karo shaqaan ku jira ma sameyn karo gurigu isku xiraya maxaan ka qaban karaa waxba kama qaban karo laakiin muhiimaddu waxay tahay qof iga cilmi leh inaan la raadsado qof waxaan ku takhasusay inaan la raadsado maadar waxaan halkan idin kala special mothers and the father inaan ilmaheena hoos u fiirino hadday albaabada isku soo xirayaan waxba qaldan hadday iskuulkii u gooyaan waxba qaldan antaani halka waxa u soo istaagay hooyadu indhaha iyo aabuu inay furtaan waxyaalo badan baa meeshan jira cunugu iskuula u diraysa albaabku soo xiranaya maxaa ka qaldan bariiska u diyaarisa wixii baad siisa cunugiisa miskaxdii wax kale ku jiro marka fadlan Soomaaliya indhaha furano dhibaatada meel kasta ay taala laakiin special Minnesota anagu dhulkan gale waa aragteen mar kasta waa ooynaa tareenada adeer ma sha Allah.
I am talking to the mothers and the community in general. I want everyone to give hand to Farhia, who pick us up from the ground. You have seen me crying on YouTube. I have had a lot of problems. My son started using drugs when he was about 16. If you see when your child is 16 or 17 and you don't know how to deal with this, you cannot help because there is nothing much you can do. You have to find someone who can help you and understand how to deal with this. That's a time that it's good for you and for your son or daughter to seek help and get assistance from people who can understand and deal with this.
waxyaraan ku daraya marka waxa kale aan ku darayo hada caawimaad baan helaa Cabdiraxmaan waa aragteen ilmaha uu caawiyaa biisula farxiyo waa aragteen gacan ku siino hadaan dadka nacaawiya gacan ku siinin cid kale oo na siinaysa malaalaara opportunity waa naloo furay dhaqaatiirteena jooga caawimaad waa heleena laakiin muhiimadda Soomaali community ay tahay isma caawinayno aan is caawino aadana u baahantiin. Thank you very much.
Okay. We have to give hand to Abdurrahman and Farhio. They are trying to help. The city, the state, and everybody else is trying to give us assistance. And if we don't help them, we're not helping our children. Let us help so that we can be helped as a community and as with our youth. So everyone, please. Let us support the organizations that are helping us, like Abdurrahman and Farhia, and we thank the city, state, and everyone else who is extending that help to us. Thank you.
Thank you. Thank you, Habra Nasra. Kalader. And we have another community member.
بسم الله السلام عليكم ورحمة الله وبركاته فرحية جروب كده قاعد بنقوم هالنقية إلهي وحن كبرية إنه فوق الجار وهوشن علوس هيان يدب كبدن وحن كلهم هالنقية مدحدين مش تشوكيت على السنة جور ريو محمود مركز درشود تاجن تكلين نوع منه مركز قاد مركز عن درشود كلنا أي نوع ما دام نقل سوق يبقى عن محن كودا هذا دباتوين كان هايسته بدن الوعي لا مش تشوكوا في عنا الله من داين لقدر قف فهمه every house waxaa dhib baa ka jira guri walba qof baa jooga inta anigu aqaanaa tobanaan ka badan kayga haddaan ka soo qaado familygayga I have a child he's 30 years old buu jiraa wuxuu isticmaalo albaabku soo xidhnayo hooyo ma maqlayo cidna ma maqlaayo wax walba waa isku dayna waxaan maynaa dhallinyaradii ii raacday guriga markaan wax walba waa isku dayey dhibka ugu badanee waxaad moodaa sharciga meesha tan yaala inuu qayb ka qaadanayo ilmuhu inuu sii xumaado intuu dhowaa uusan dembi kala gelin ama uusan maxkamad aadin ama aanu kiis gelinin oo waxaanu isticmaalayaa wuxuu kooban yihiin hooyadii buu kan hayaa qofna ma maqlaayo qof walba wuxuu waa saxraanahay waxba ma ogid guriga oo dhan alaabtan la isu keenaa ayuu gubayaa biyaa lagu furaya guriga markaad booliisku yeelo ma cid maqasho waxa lagu leeyahay wax dhibaato ama wuxuu ku leeyahay okay I don't have any problem I am good health waxa lagu leeyahay qofkan is okay wax dhiba ma qabo adiga maxaad ka duuba qof weyn oo 30 years old when the police ask you, are you okay? He said, I'm okay. I don't have any problem. I don't have any problem. What do you? I don't use anything. Freaking waxa soo ka sameynaya hooyo ma maqlaayo hooyadii lafteedu wuxuu ku leeyahay adaa waalan anigu ma waali marka waxaan isku daynay hal mar baan wax ku guuleysanay inaan dhakhtar helno dhakhtarkaan geynay way noo suurta gashay emergency inaan geyno way arkeen ninkan inuu isbitaal baa la seexiyey 3 bilood min dira 4 bilood baan u maaynayaa marba meel loo bedelay waxa loo diray meelahan lagu sameeyo caruuraha lagu sameeyo wuu soo bedelay wuu fiicnaaday nin fiican buu noqday sidii soo ku soo noqday ninka fiican ma jiro hooyadii buu guriga kula nool yahay dhibkii muddo ka bacdi markuu meesha ka soo baxay halkii ka bilaabay hadda tiyaana haysato ugu daran wax alla waxaan sameeyay ma aqaano wax alla waxaan ku fikirin ma jirto maxaad nagu caawin kartaan maanta maxaad nagu caawin kartaan kit alison baa jooga police baan u wacnay police wuxuu waxba kama qaban karno waxba kama qaban karno salaamu calaykum raxmatullahi wabarakaatuh
we have problems, huge problems, and sometimes the children and the system sometimes make us think that the system wants the children to go through this. Because your child is here, they are using something, they are creating chaos, they are not listening to the parents and anyone else. If you call the police, they will talk nicely and respectfully, and the police will say, are you okay? I'm okay, I have no problem. And it seems that the parents are not allowed really to take steps to take care of their children. It seems the system is limiting the parents to help the children. The Attorney General is here, Keith, and we really don't know. In every house there was a child, there is a child that has a problem. And the parents do not know how to deal with them. When they try to help their child, it seems that the child is trained a way that they can beat the parents so that the parents cannot do anything and put them in a situation where the parent becomes helpless and the child is going to a way that is leading them to become criminals and end up in jail. So what can we do? What do we need to do to help the children? I think the system should be looked at, and a system should be put in place where the parents are empowered in such a way that they can put their child in a good situation, can help them in a non-abusive way, but in a way that they can really help their child and get hold of them. And the police and the peace officers should be helping the parents and assist them in a way that the children should listen to the parents instead of talking to them and saying, he's all right, and leaving. So What can we do? How should we do? How should we resolve this issue?
Why the mother she called the police? Because she see his danger herself and with the society. The reason the mother is called the police is that she's feeling and she see his danger herself and the society. Because he's starting to use a fire in the home when he's drunk, when he's use something. She's sleeping, the children is other children is sleeping. When when the police came, they say, "Oh, I am okay. I don't have a problem." He put the water all the home. When the children wake up, there is hold the. wax kasta oo guriga dhex yaalla wuu soo gurayaa dab buu ku qabanayaa wax kasta oo guriga yaalla biyo ku furaya guriga dhan ilaa uu ceel noqdo hadhow marka loo yimaado wax dhibi ma jiraan annaga waxaan arkaynaa inuu naftiisa halis ku yahay waa ilmahayagii.
Okay. Okay. Okay, a good thing happened here. The doctor offered that he will help the situation and talk to the parent. And the father is complaining that his son started a fire in the house, flooded the whole house when everybody was sleeping. And the mother was afraid for her children, herself, and her own child, who is doing the same, that problem. And when the police comes, are you okay? I'm okay. I have no problem. They will leave. The reason the mother called is because she saw that her son is dangerous to himself, to the society, to the household, to the children, and the police should heed when a mother calls them. They should be asking her the questions, finding out the problems. She's complaining. He has to empower the parents. The parents should be empowered to help their children.
Thank you, Hassan Tahi. Right now we have Hassanay, who's a community leader, and then we have a few 245G providers for this for our East African community that also like to have a few minutes.
Assalamu alaikum wa rahmatullahi wa barakatuh. I want to thank you all for coming and listening to the community. I'm the executive director of the Minnesota Somali Community Center. I've pretty much, I've spent legislation time with Mahmoud and Senator Hoffman. Julie, I think last year we had a meeting about it. We just met with Jeremy, and Jody Hampstead and I go way back. We used to be working together, and she became my boss. So I pretty much have a relationship with everybody in this panel. I'll tell you, this is my community, and right around here there are some individuals that I've taken to treatment before. We have had individuals that have lost their kids in this community. I'm the person who gets the call at night when somebody's child passes away. So it's not something that I'm proud of, but it's something that our community is facing. We have had so many deaths over here. A lot of trauma is in the community right now. Opioid has taken a large piece of our lives apart. We see ourselves sleeping on the street at night. We have tried to go around and pick individuals. We have done it all, and we still want to do more. Part of the problem we have in some of the organization, when I reached out to Julie to find out what organizations are in the Somali community last year, the challenges they have is they might get a grant, but they don't have the money to spend up front. So they end up doing little by little. And then in some instances, when we look at those grants that they're given, it's only like $85,000 a year, so it's not very impactful. We are hoping that this will change. that you go back to Hennepin County. I've had conversation with the commissioners. Madam Commissioner, I hope you can go back and look at organizations that are being funded. If they don't have money up front, you should be able to lead and give them more funding up front so they'll be able to serve people in the fastest way possible. That is one of the issues that we have. And then the other issue we have is on the public safety side. Tomorrow we're going to have a meeting with the Hennepin County Attorney, Mary Moriarty, at Center for Changing Lives on 24th and Park. And we're going to discuss about what we can do when we have our loved ones who don't want to go to treatment. What are the things that we can do as a community? And we're also going to talk about our youth justice. We have a lot of individuals who we take to treatment that have been picking up little charges from, being in the train without paying tickets and sleeping on the bus, lines and all of that stuff. So we want to find a solution for them. We don't want something dragging them down for years to come. So I want to thank you all for coming, but you have to know we have a big issue and we need a big response to it to match the type of issues that we have in the community. Thank you.
And hello, and I had to steal the microphone from him. I traveled all the way from DC to come here, and I work at the National Institute of Mental Health. I'm a Somali, but I got my PhD in neuroscience, and I worked at the National Institute on Drug Abuse before I went to the National Institute of Mental Health. And I come here a lot, and just to try to help the community. But there are people like me, who are culturally competent and who know what an evidence-based intervention would be for our community. But we don't find places for us to go to give that knowledge that we have. These two guys are sitting next to me. They're both also doctors like me, but we don't, and it frustrates us. We have a daily job like every one of you has, but we also are trying to contribute to this. So I would like to know, how can we, people like us, professionals, can contribute to this, even in our free and spare time? Because I think there are nuances, there are between the lines things that we know. We have the knowledge, that maybe the medical knowledge, but there are also these other things that we know that maybe would help have traction for all the programs that you guys run. So that's what I wanted to say, and I wanted also to introduce other people, and I wanted you guys to know there are people like us who exist also in this community.
So I'm Nasir Warfa. I'm from the UK. I've worked in the field of mental health and addiction, especially with a focus on CAT, for about 20 years, mostly working with the community, advocating for the community to know about these issues. Now, we're talking about very serious issues, very complex, the link between mental illness and substance misuse. So we all know that people who have substance misuse are likely to develop psychological problems, right? Not necessarily people who have mental illness may develop substance misuse behavior, but it's also likely. Now, we can ask this question, as a community, how did we end up in this position where our young people, so many of them, are having a mental breakdown and substance misuse, and with little access to mental health services? Now, that then can lead to more questions. Is it because this is the result of intergenerational trauma? Their parents went through horrific war trauma, right? That messes up the child-parent attachment relationship that might lead to having psychological problems even from young age. Now, from my perspective and what I'm hearing from here today, I think it's bigger than that as well. And I feel, using also my professional knowledge of many years working with the community, and I'm going to tell you one or two examples. The biggest challenge the community is facing is stigma of mental illness. And I think, you know, for here and this movement, I feel we're into kind of historical movement. This is a progressive where we have young people coming in front of the community saying we had issues with addiction and mental illness, and we are getting better, we are receiving treatment, and we have a better hope. I think this is a progress from what is perceived to be a conservative society. I just came back from the Somali region of Ethiopia. I very quickly, I just want to underline that with the many challenges we are facing, that mental stigma is the biggest. For example, I stopped there accidentally in the Somali region, and I was found that a region of 6.5 million Somalis have no access to a mental hospital, no access to psychological services. People are using the streets as a hospital. You know, people are chained today in their houses. This is what stigma does to our society.
What I want to add is this. You have heard many from the Somali background talking about having people who can be role models. Here we have 3 PhDs who have done a lot of research. When I think Julie was speaking earlier about the steps Hennepin County would take, she did mention about prevention and other things. What we really believe also is that research is critical. I spent 9 years of my life at Mayo Clinic. We did research on liver disease and liver cancer in the Somali community. And we did learn lessons that are unique for these people. Similarly, when it comes to mental health issues, I think people like us should be playing a part in assisting in the state so that we can study the root cause of this problem, then come up with solutions that are unique for this particular community as well as East Africans. So yes, it's good to listen about people who have gone through the issue. Sorry to hear the senator lost their son, but we can help through our expertise if the state is ready. Yes, there are issues, maybe we can talk that privately, but collectively we can do really better. Thank you very much.
Assalamu alaikum, everybody. My name is Mus'ab, and I own a culturally specific treatment center that have been working in the community for a very long time. A little background about myself: I've done youth programs in the community, I've done outreaches, worked in mosques. So a lot of the people that are faced by opioids are my friends, are people that I grew up with, family members that I have lost, people that are in the jail system right now due to mental health services. So one of the things that is very frustrating in our community for us people that are providing the services is when it comes to listening sessions like this, we feel like we are put in a back burner. When it comes to, I came here to talk with you guys, not just to talk to my community, because me and the community know each other. From the things that we need from you guys is we talk a lot about culturally specific programs, and when we are in the work, doing the actual work, some of the things that we have issues with is a lot of the programs that we do run are IOP, they are intensive outpatients. In our community, in our culture, in our religion, harm reduction does not work for us. We are people that are focused on, because of due to our religion, we do not do where you can practice your faith and also use at the same time. So the models that do work for us are these very almost intensive residential-like, but a lot of the residential programs are only 30 days. So us running an outpatient that is intensive outpatients, some of the difficulties that we do have are getting licenses for our lodgings. We have been running a program for almost a year, and we have 18 beds right now that are all filled up. And out of all those 18 beds, some of our licenses that we wanted through MDH, we still have not got any answers. A lot of the places, a lot of our houses that we are housing, some of the guys that we are helping, we have great relationship with Hennepin County jail system, the drug court. We are those parents, those programs that are going to these jail systems, dealing with people that have co-occurring mental health and substance use disorders. We are advocating for them. We are bringing them to our centers. But the frustration comes in from when we've been running a program for up to a year, and we're not getting licensing through FDH. Our houses are costing us more money because of we don't want our youth to be outside once they get these treatments and these services. So we have all around workers in our homes plus the rent, and now each house is costing us almost 15 to 20,000 a month. So imagine doing that, and insurances always run back, and some of the people that we're dealing with are young people that are coming from homelessness, and they don't even have insurance. So we have to go through Hennepin County and the counties that they were at to make sure that they do CPR forms and all of that. So the frustration for us is, and what we want you guys to understand is, recognize the people that are doing these works, the people that are in these treatments, that are doing the culturally specific centers. So when we apply for a lot of these grants or try to connect with the community, 9 out of 10 times our names are not even mentioned. We don't even get a response back from you guys because of we're not in the lights of people. So a lot of us reach out to us. Some of the things MDH can help us out, and DHS is when it comes to licensing and when it comes to audits, we are doing something for our community. We have the correct clinicians, we have the correct therapists, but those little like things that we do mess up on, you guys give us a lot of penalties. You guys do not show us the way, and the frustration when I call or I try to contact somebody, it's always talk to this department, talk to that department. You guys are close after 5. So now it's like, okay, we want to say that we want to help out our community that has been in a very frustrating way. We lost a lot of people, a lot of great people. There were men and women that used to do a lot of community work, that used to do a lot of youth programs, advocacy, that were mentoring a lot of the young people that you guys see in these facilities right now. But because of we did not have the correct people to move forward the programs that we're running, it gets shut down. So even from when it comes to housing department, once our guys finish up the program and they graduate a 90-day program, a 180 days program, we don't have a place to take them. So now what happens? They go back to the streets, they start using again, and then now what? Then you get another call, a guy that graduated from your program now OD'd. And that is not on us. We did our job. That is supposed to be on you guys. So please help us out with these. We don't just want only a listening session, but what we want is for you guys to listen and reach out to the people that are doing. I have my cards. I will connect with you guys. We have been doing the work. We just want the resources that were supposed to be allocated to us, given to us. Thank you so much.
Farhia, I think there are
Thank
some
you.
sisters who wanted to speak in the middle there. I
yes,
know it's Maghrib time.
I know we're.
Salah time already.
Come on up if you want to speak. I don't know. Okay, Ali. Let her speak and then you're next.
No,
Okay.
I don't.
Okay,
This is
here.
not good.
Her speak first.
Please,
Yeah.
I was
Just
thinking, Mama.
yeah.
Sorry, honey, because I'm old. I want to go home. Yeah. Hello, my name is Halima, and I'm Somali community advocacy volunteer. And first, okay. Somali community volunteer because I was activist in my country. I come from war in 20 years inside the war, and I was helping the refugees in Uganda too, to American Refugee Committee and working with them voluntarily, and they award me. I have the award. So when I came here, I thought everything will be good and fine, but first of all, I want to thank you for United States of government, how they help us and took from all around the world. We thank you very much of that, and you deserve to be thanks. You have to clap for that. When I came here, I have seen something very sad. What happened in this state is very, very hard to witness. Kids are teenagers addicted, drug addicted, and they dying in the middle of the road. And I was shocked. While I was witnessing all this, I met Farhia, who also fighting for helping the kids and the families, communities. Farhia has a champion for this community really, and I appreciate for that. And Farhia has helped many families whose kids are teenagers, drug addicted. She educate the families about the drugs and the other, because I don't want to go that much far. But what I have to abbreviate because a lot of people are waiting me. And because she was being recovered herself, demonstrating the parents and the reliance and the family who has been going through touching time. And really I appreciate what she has done for the community. At this moment, at this point, we ask the representatives, not the legal ones, the one who represented the government as a political representative like Mohammed Noor or others, but we need 3 locations in Minneapolis. I don't know how the sectors they have. I want you to know that because this is very, very important. But because the community or the people, if they want to have a problem, they cannot contact straight away the representative because he may be busy or something else. I really underline on that, they have to represent the district under the city council because people are needed instead of looking Mahmoud or some other people. The country should always lead people to the right path, direction for success. The problem was the culture diversity. When the people arrive here, they don't understand actually what to do because our country is different and it is easy to raise the children. But here, there is a lot of different things which are different nationalities and different people and the behavior different and a lot of things. So I don't want to go that far much. The reason is because of the physical and the religious and the other cultures. So we appreciate that.
Thank you, Javier. Thank you. I have this young woman come on up, inshallah.
Thank you, Nisi, and thank you, everybody, the legislature. Thank you so much for this opportunity. I am here representing NIYYAH. NIYYAH is an All Nations Youth and Community Assistance Program. We provide culturally specific services to the West African immigrant communities. And I want to use this opportunity to thank you all for coming out to hear us. I'm so privileged to be here. I was invited. And I was never aware that there is this kind of awareness when it comes to opioid addiction. This monster is destroying our communities. It's not just destroying our children, it's destroying our homes. Because when a child is not okay, it brings shame, it brings guilt, there is blame, and then there is conflict in the home that can never be resolved. We are immigrants and we are so happy that you have given us the opportunity to thrive in this country. But it's very painful that a lot of us will go home without our children. We came here because we want a better life for them. And it's painful when we see them dying in the community. We are helpless. We need you to help us create the awareness. The awareness is the most important thing, that these little ones running around here, we begin to let them know that there is a monster out there. Because this is not something that is affecting me alone. Your child, your family will be affected. We have boundaries. We can say, I don't like you, I will not come near you. But we can't do it with the children. They go to the same schools. They share together. Sometimes, because they feel the pain of their friends going down that route, they will want to take the route so that they all can fit in together. So please, we need you to help us. We want you to extend this awareness to other communities. The Africans, the West Africans, the Central Africans, and every one of us that is here, so that we can all benefit from the beauty of this land. Thank you.
Assalamu alaikum.
Thank you guys for coming today. I actually have a few questions for you guys. Not really necessarily any statements, but if you guys would like, you can answer these questions right now, or you can write them down and maybe answer them. But the first thing I want to say is thank you guys for speaking to. I really like the idea of research. Research is very important. I've lived in this community for my entire life. I can tell you that it doesn't take a lot of research to know that the reason that our kids are going into the things that they're going into is because of lack of resources. And I've been at listening sessions like this, and I've been listening to adults speak since I was a child, and now I'm an adult. I didn't have any facial hair. Now I have a lot of facial hair, so you guys can kind of get the gist of it, right? It's very simple. I've been telling Mahmoud this for years. I've been telling everybody for years. The people that are at the short end of the stick of bureaucracy is the general people like this. I can honestly tell you 90% of the people that spoke today are not people from this community, and are not people that are kids that are every day being affected by opioids. They don't feel comfortable in spaces like this. They don't come to spaces like this. They're sitting and standing outside, probably across the street, because like they're like, what are they gonna do, right? If I go over there and I tell them how I've been feeling forever. The majority of the problem, to answer your questions, is this: there's a lack of direct resources. So when kids graduate from high school, they lack the resources that they need for them to build a career and build a life plan after high school. Once they graduate from high school, they're no longer welcome. They're welcome, but they don't have any resources here in this community center. So what do they do? Where do they go? If they're not interested in college, what do they do? Where do they go? If they don't have any trade programs, what do they do? Where do they go? That's one thing. The second thing is 90 to 100% of the kids that grow up in this community deal with trauma, either direct trauma or trauma because of the stuff that's happening in their community, from being locked up and abused by police forces, to gun violence, to watching a friend overdose, to a friend dying. When a human being deals with trauma, they need ways to cope. Most of our kids don't have adequate resources to healthcare. They don't have adequate resources to ways in which they can get therapy, right? They don't have any of that stuff, and they don't even know what it is. And because of that, they go into things like substance abuse, right? So again, all of this stuff it's not, honestly, I'm gonna tell you the truth, it's not rocket science. You don't really need to do like a crazy big thing like this for it, honestly. The first question I'm gonna ask you guys is, you guys all do an amazing job in your respective fields. How many of you guys have a kid from this community who looks like me in their room or in their meetings? How many of you guys like really like shook hands and said, hey, you know, I hear you're from the Cedar Riverside community. There's, like you guys have all said, the statistics of the astronomical disparities with the kids here growing up with terrible issues and all of these crazy stuff, right? How many of you guys have honestly had, and this is not a question to say it like in a way where like you're a bad person because you don't have it. That's not my goal, but I just want you guys to really think about it. Like, you want to solve a problem, you got to really talk to the people that are dealing with the problem, not the bureaucracies that are trying to deal with the problem, right? I tell you the truth, big shout out to all of the, like, what he's doing is amazing. I tell you, wallahi, what he's doing is amazing. And we need people like him, right? But this is a part of the bureaucracy, right? And in all honesty, it's a part of the systems that have been created so that he has to go through all of these systems, all of these things to get what he needs in the adequate help. But how often have you guys come to this community center before today? You feel what I'm saying? And if you have, like, how many of the kids here do you know, right? It's just like simple stuff like that. So I want to help you guys do your job better. Everybody here wants to help you guys do your jobs better, right? So all of these questions are maybe some questions that you guys can write down and maybe ask yourself. And again, I'm a big fan of doing stuff together. I can't do the things and get the help from my friends. I've lost 20 plus friends to this, family members to this, right? I can't do that without you guys. There's no shot, there's no chance. But I can promise y'all this, y'all really can't do y'all jobs without us either, right? That's why you guys are here today. So I honestly think you guys should really sit down with a lot of these people, right? Have serious conversations and say, okay, what are direct ways in which we can help with those things that I talked about before, which is what can kids do after high school that can give them, and all of this has to be culturally specific. This doesn't count. It doesn't count if it's just for all African Americans or all people. It has to be culturally specific. And it has to be culturally specific where Somali moms and Somali dads can trust the people that they're taking the kids to, and they can understand and they know, okay, yeah, Somali, I get it, I understand. Because this community has been through a lot, but it's a beautiful community. And again, I want to end with, I thank you guys very much. The job that you guys are trying to do is not easy. It really isn't. And in all honesty, a lot of you guys aren't from this community. So I commend you guys for coming here. I commend you guys for having a conversation with us and letting us speak our minds, right? And it's not really about this person or that person. It's really about us and what we can do together, right? So I don't want to talk too much, but honestly, like maybe some of those questions that I had, after this, maybe get up and ask some of the people personally. Say, hey, you know, what are some things that I can do for you? How can you get involved more? Here's my card, here's my email. That networking aspect is very important so they can have a direct link to you guys. So thank you so much.
Hello all, my name is Simsim Abdi. First and foremost, I'd like to thank Farhia for having me here today. What an amazing event put together here, and I appreciate the work you do for the East African community when it comes to addiction. I'm the Public Relations Director and one of the primary counselors at Reform Recovery. I'm deeply committed to fostering positive change within our community, particularly in addressing the challenges of addiction. At Reform Recovery, we have embarked on a transformative journey guided by the principle of harm reduction. Unlike traditional one-size-fits-all methods, we believe in meeting our clients exactly where they are on their path to recovery. Our approach recognizes that each individual's journey is unique, shaped by personal experiences, cultural backgrounds, and diverse circumstances. In our pursuit of effective solutions, we consistently depart from the culturally specific or 12-step program model. Instead, we embrace a dynamic and flexible methodology that is built upon the foundations of understanding, compassion, and partnership. Our dedicated team collaborates closely with our clients, acknowledging their autonomy and respecting their personal choices. What sets us apart is our commitment to customization. We recognize that traditional methods may not resonate with everyone, especially with culturally diverse communities. This is why our tailored approach resonates so strongly by building a treatment plan around each client's specific needs and values. We empower them at Reform to take control of their recovery journey. This is a new approach to the East African community, and we believe that harm reduction is a model that will help those who are struggling with addiction. Our community deserves an approach that addresses that ever-evolving landscape of addiction, and one that aligns with modern perspectives and cultural diversity. We firmly believe that our harm reduction model can pave the way for brighter futures. Our efforts are not just about recovery. They encompass revitalization, reconnection, and renewed hope. I'm asking the legislator, DHS Commissioner, and Attorney General to fund treatment and to make it treatment friendly for all different treatment approaches, and for those like mine who come from my community that are underserved to have access to the treatment services they need to fight addiction. Thank you.
Thank you. And we have our last community member here, Kale Hawa.
السلام عليكم ورحمة الله وبركاته. من مغلسان مسعود ويافك. مجاعي حوالي ده سومالي أمريكا كوها الله يدنا إنجليزا كوها الله يا. سيدر سداد سنة دجنا هاي. صدق سنة كم إذا فرحية واقعنا. فرحية إن وحوبا هنت هاي عاونات ضيدا. كو. وحوبا هنت هاي إن أنا قارن حد قف مركو حد جياه لما قريو. وحوبا إن لجرب استاجو. wuxuu u baahan in la support gareeyo anaga cilada aan leenahay waxa waaye qofkeena talentiga leh awoodda leh gadaal baa u dhignaa mid bila talent aan ka hormarinaa waa inaan joojinaa taa farxiyo waxay u baahan tahay inaan u soo baxno inaan miirinadeeda ka qayb galno inaan ogaano waxay community-ga u qabato taasaan uga baxayaa farxiyateeda hooyooyinkana mid baan leeyahay hooyooyinka anigu hooyana afar ciyaal ay joogto ما شاء الله تبارك الله ان واحد قرصته way ku qarsadaan hadaada adigu hadlin cidna kuma hadlayso hadaada adigu raadsan daawada iyo meesha cunugaaga laga caawin karo cidna kuma caawin karto iska daaya waxa aad qarinaysaan cunugaagan ilaahay baa ku siiya ilaahay baana u qoray waxaan inay ku dhacdo laakiin as you can inaad survive garaysid juhdi gelisid aadan ka rajo dhiganin rajada lagama quusto one day un baa laga yaabaa inuu soo noqdo laakiin adigu inaad give up garaynin inuusan khayrkaa kugu caayin cunugaaga annaga waxaa nala haray waa isku caynaa dhibaatada mana sheegano dhibaatada markaan iska dhaafno waddankan waa waddan opportunity leh ka faa'iidaysta opportunitygiisa ilmahaaga opportunity badan buu haysaa haddii uu waddada kaa galo isku day inaad cunugaaga safe garaysato and I'm going to say one thing. I say three things. Thank you for Farhiya. She's the leader of our community. She hopes a lot. And she's our stars. So we're going to work with her as we can. I live here 8 years, so I know more than 3 years. I say one thing about my community and the mothers. I'm a mother. So a mother, she don't have to be ashamed. She don't have to hide what her kids are through and through. She have to come and ask help. Whatever she, like who she getting help for. Farhiya, Mukhtar, I don't think Mukhtar is here today. So do not be ashamed. Don't shy. Don't go behind the door. Come out of the door. Say what you can. Save your child. You have a lot of opportunity. And I'm going to say one thing about you. As you can, our community need a hope. They need opportunity. They need a shelters. They need like a lot of things. So I don't want you to be like this the first meeting, but we need you to come back as you can and meet with the community. I wish to for like if you can go each door or each parent. Sometimes we have a playground. If you can come one day and involve with a parent, ask what the issue they're going through. It was nice to us. Thank you so much. I appreciate it for coming today. Thank you for here.
MashaAllah. Thank you so much. Mahatri?
I just wanted to mention we have got Representative Nadeau joining us here.
Yes,
listening,
Representative Dan Nadeau. Thank you. So, you heard from my community today. You were here. You showed up for us. I want to say thank you from the bottom of my heart. Really. As part of as I founded this new organization. It's a recovery community organization. As you know, recovery community organizations oftentimes don't get the necessary funding that we need. 80% of the federal block grant goes right back into treatment. We need more funding for recovery-oriented systems of care, culturally responsive treatment centers, recovery community organizations. My community needs your support and your leadership as we continue to work with ORAC, the Office of Addiction and Recovery, and DHS. Yes. Sure.
No, finish it now.
No, go ahead. No, I was just going to wrap up, but if you want to go, this is Awal, one of our community health workers. Go ahead, Awal.
Yeah, thank you, Faria. So my name is Awal Wundisa. I think I don't want to take much of your time. So thank you for coming today to Cedar Riverside community and to Brian Cole. So like she said and everybody said in this panel, I think there is a lot has been happening in all communities, specifically to East Africa, because this is a new trend for us since we joined or we came to this country. So I work with Pillsbury United Communities as a director of community health, and we started through having so many conversations with the community. One of the program which is opioid overdose for East African and also Latinos and African Americans. So at 3 locations of Pillsbury. So we have a grant from DHS, but like all leaders from the community saying, it is not enough. It is really not enough, and we need. The reason why I just take the mic from Faria. We do not only need the treatment recovery resource, we also need the prevention, because that is where we have to focus, and that we have to just do so many work, as we are working with Faria Twin City Health Service and so many leaders in this community, focusing so many BICOP communities. So I know there is a lot on your desk, there is a lot in your email, there is a lot in front of you. You are not only here for East African, you are here for the whole state. We understand that. But as this is a new trend for us, we need your attention. I think that is what everybody is just amplifying. So that's all I want to add. Thank you.
Thank you, and I think that is a wrap up. I'm gonna give it back to Jeremy Drucker to close us out.
Thanks, Farhia, and thanks everyone for coming, and thank to all the folks who came out here from state and county government. We heard really loud and clear from you all, and I said it at the beginning that this is the beginning of a conversation, not the end of a conversation. I think we got a lot of really good information. We were taking notes. We're going back and we're going to collate all those notes and take a look at it, but we will be back to continue this conversation with you. And I think, the key here is that none of us can do this alone. The state can't do it alone. The county can't do it alone. ORAC can't do it alone. You can't do it alone. But I think together, when we get together, when we can pool our resources, when we pool our knowledge, we can do this together. And so I want to thank you for coming out tonight, and we look forward to talking to you again. Thank you.
Arkafuuna kabajamtootaa fi jaalatamtoota daawwattoota Oromiyaa 11 akkam jirtan nagaa jirtan isin jecha ardha sagantaa hawaasaa tokko irratti argamna. Sagantaan hawaasaa ammaan tana asitti geggeeffamee isin dabarsaa turre sagantaa substance abuse opioid fi substance abuse recovery dha. Namoonni qoricha hadoocha biyya Ameerikaa keessattuu kutaa bulchiinsa Minnesota keessatti fayyadamaa jiran ilmaan keenya kanneen sababa araadaatiin badaa jiran qoricha hadoochu fayyadamaa maatiin ijoollee hedduu dhabaa jira. Balaan kun hawaasa waliin gahaa waan jiruuf warri isteetaasitti dhufeetiin hawaasa kana mari'achiisaa jira. Akkamiin ijoollee kana karaa irraa galchuu dandeenya? Akkamiin qoricha hadoochu kanarraa isaan baraaruu dandeenya? Bajanni gama mootummaa Ameerikaatii qophaa'ee isteenni Minisootaadhaa fandii gadhiisuudhaaf deemaa jira. Hawaasni keenya hoo kana keessatti qooda maal fudhataa jira waan jedhu. Ogeeyyoonni fayyaa hawaasa keessatti tajaajila garaagaraa kennitan maal hojjetaa jirtan? Ijoolleen keenya haala kamiin bajeta kanarraa fayyadamuu danda'an? Akkamiin karaa irraa galchuu dandeenya? Akkamiin araada isaan keessatti kufan irraa isaan baraaruu dandeenya waan jedhu. Hojii guddatu hawaasa kana eeggata waan taateef hawaasni keenya ammas itti yaadee namoonni waan kana hin yaadinis akkuma argaa jirtan hawaasni Somaaleedhaa nu dursee deemee jira. Bajeta kanas fudhachuudhaaf imalli isaan godhaa jiran sagantaa guddaa kana fakkaatu asitti qopheessanii Brian Coyle keessatti qopheessanii warroota hooggantoota mootummaa dipaartimentii fayyaa irraa bulchiinsa irraa atorni jeneraalis waamanii asitti argamanii jiran. Marii guddaa hawaasa isaanii jiran. Keenya hoo maal godhaa jiran? Manneen amantaa charchiiwwan Oromoodhaa biyya kanatti argaman maal hojjetaa jiran? Bajanni mootummaatii jira. Hojiin hawaasa kana tajaajiluudhaan ijoollee kana akka isaan gara qoricha hadoochuutti hin makamin gargaaruudhaan ofiifis tajaajilamuudhaan hawaasni keenya dammaqinaan wanni inni hojjechuu qabu hojii manaa guddaatu nu eeggata waan ta'eef hojii kana keessatti bobba'uudhaan hawaasni keenya ammas hojii isarraa eeggamu abbootiin qabeenyaa haa taatu abbootiin amantaa haa taatu namoonni biyya kana baratan haa taatu namoonni hojii kana keessatti bobba'uu barbaadan iskuulallee haa taatu kallattii hundaan ijoollee keenya baraaruudhaaf qoricha hadoochurraa isaan deebisuudhaaf kanneen karatti hafanii hoomlasii ta'anii jiran mana dhabanii karatti ba'anii jiran kanneen abbaa faadhaan wal lolanii sababa qoricha hadoochu fayyadamuu isaaniitiin karatti bahanii kufanii jiran abbaa kanaa nama isaaniin jedhu ijoollee dhabanii jiran karaarraa kaasuudhaaf erga mootummaan faana takka kaasee hangana tarkaanfate nuti hoo hojiin hojjetaa jirru maali? Ogeeyyoonni fayyaa Oromoodhaa maal hojjetaa jirtan? Abbootiin qabeenyaa Oromoodhaa maal hojjetaa jirtan? Namoonni gama ogummaa fayyaatiin baratanoo maal hojjetaa jirtan? Hojii gurguddaatu hojii uumnee hojii kana keessatti bobbaanee bajeta gara mootummaatiin jirus itti fayyadamuu dandeenya. Hojii uumuus dandeenya waan ta'eef namoonni dandeettii qabdanis waan kana irratti bobbaatanii ammumaan tana keessattuu opioids substance use abuse waan jedhu kana irratti akka fuula keessan xiyyeeffatan kaawuntiiwwan keessatti argamtan hunda irratti gaafii kana dhiyeessitanii keessattuu hawaasni East Afrikaan irraa dhufe hawaasni Oromoodhaa kan lakkoofsi isaa bal'aan Minisootaa keessa jiru haqa isaa malu osoo hin argatin hafaa jira waan taateef hojii manaa nuuf haa ta'u waldaan hawaasa Oromoodhaatis hojii guddaatu isaan eeggata waan taateef hojii manaa kana fudhadhaatiin isteeta dubbisuu haa taatu kaawuntiiwwan garaagaraa dubbisuu haa taatu City of Minneapolis St. Paul akkasumas Ramsey Community kaawuntiiwwan jiran guutuu dubbisuudhaan waan gadhiifamaa jiru kana masjidni bajeta ittiin argachuu danda'a charchiin bajeta ittiin argachuu danda'a ijoollee barsiisuudhaan ijoollee gara araadaa akka hin deemne godhuudhaan hojiin gurguddaan hojjetamuudhaaf waan deemaa jiruuf nutis daddafnee miila keenya tarkaanfanne haqa keenya haa gaafannuun dhaamsa keenya har'aati gaafii mana hojii manaa isiniif haa ta'uun nagaa walitti dhaammannaa sagantaa hawaasaa biraatiin hanga walitti deebinuuf nagaan nuuf jiraadhaa isiniin jenna.